And to speak more on that, I would like to sponsor Graham Moore.
Welcome, please.
Good evening, Somerville City Councilors. I'm so grateful to this body for giving me the opportunity to speak. Thank you so much. My name is Graham Moore. I'm the Educational Outreach Director for the Natural Psychedelics Ballot Measure campaign. I'm also a lifelong Cantabrigian who has spent a lot of time in Somerville and who is deeply personally invested in this issue. I have obsessive compulsive disorder, better known as OCD. I also still contend with the trauma of the death of my best friend, a Somerville resident, in 2013. She and I met as a consequence of us both taking leave from college due to serious mental illness. Seven weeks after she was forcibly hospitalized for her depression, she died by suicide in her apartment near Davis Square. My mother discovered her body while I was waiting in the car outside. I'm sorry to share that the suicide rate in Massachusetts now is nearly the same as it was back then, over a decade ago. So too is the difficulty in finding adequate care. People in Massachusetts suffering from life-threatening and debilitating disorders, including severe depression, PTSD, OCD, addictions to opioids, alcohol, and tobacco, as well as end-of-life anxiety and depression, desperately need and deserve more options. Providing more treatment options is exactly what the Natural Psychedelics Substances Act will do. Every substance in the measure has demonstrated therapeutic value, has been well tolerated in clinical trials, and is legally accessible for therapeutic purposes abroad already. Furthermore, legal access to these substances has never been observed to harm public health. It is well past time that we stop forcing veterans, hospice patients, and others with severe distress to travel out of state or risk prosecution for accessing effective and groundbreaking treatments. Across the world, medical researchers at respected institutions such as Johns Hopkins University and the Dana-Farber Cancer Institute in Massachusetts have been researching the clinical efficacy of psychedelics. One such researcher recently presented that in her clinical trial, the natural psychedelic psilocybin appeared more effective for my condition, OCD, than any other treatment. This does not overly surprise me, since I use psilocybin in consultation with my psychiatrist at Mass General Hospital, who was an OCD specialist, in order for me to heal from, not just reduce symptoms of, crippling OCD. In 2021, among some of my hardest days, Somerville's decision to deprioritize arrests of people using natural psychedelics was a source of inspiration and hope. I think I will always remember the profound relief I felt after my own city, Cambridge, followed Somerville's example. Now, with your help, I'm optimistic we can bring healing and common sense reform to the rest of the state. Thank you again, Somerville City Councilors, for the opportunity to speak, and thank you for your courage in standing up for people like me and my best friend, who always deserved more options to treat serious mental illness and should never have been punished for trying to get better. Thank you, thank you, thank you.
Thank you for sharing that story.